Hello everyone, welcome back to the channel. Today we are learning about stab wound. Definition of injury. Injury is any harm, whatever illegally caused to a body, mind, reputation and property. Next point is classification of injury. There are total 5 types of injury. Uh, Mechanical injury. First one is mechanical injury. Second one is thermal injuries. Third is firearm injuries. Fourth one is chemical injuries and fifth one is injuries due to physical agent. Definition of stab wound. Stab wound is a piercing wound produced by application of mechanical force along with long axis of a narrow or pointed object. Stab wound is a type of mechanical injury. It is caused by sharp force of a weapon. Now the classification of stab wound. Stab wound is classified on the different basis. First basis is based on the depth of penetration. In that, first one is penetrating wound and second one is perforating wounds. Next, second basis is based on the causative weapon. In that, first one is incisive stab wound and second one is lacerated stab wound. So in the incisive stab wound, these are caused by sharp edge pointed weapons, penetrating wound, perforating wound. Lancet stab wound. These wounds are caused by not so sharp weapon or relatively blunt penetrating weapon. Penetrating wound and perforating wound are the type of wound present in that condition. Now the penetrating wound. What is penetrating wound? Weapon enter into the body cavity producing only one wound. That is wound of entry is called as penetrating wound. Perforating wound. What is perforating wound? Weapon after entering into one side of the body will come out through the other side producing two wounds is called as perforating wound. So the wound which is caused by the entering of the weapon is called as penetrating wound and wound caused by the exit of weapon through the body is called as perforating wound. Wound of entry through which the weapon enter into the body, it is larger and with inverted edges. Wound of exit through which the tip of weapon emerges out of the body, it is usually smaller with inverted edges. You can see the pictures of penetrating wound and perforating wound. Penetrating wound indicates the entry only. The object enters but does not exit, stays inside is called as. Here we are having only penetrating one, but in the next case, where in the next picture you can see the perforating wound, you can clearly see the entry of weapon and exit of weapon, where the entry causes larger wound as compared to the exit of weapon. Features. First one is type of weapon, second shape of wound, third depth and thrust, fourth, movement of weapon in the wound. Fifth, direction of stab wound. Sixth, patterns of stab injuries. And seventh, dimension of wound. Types of weapons used. Commonly, a knife is used to afflict the stab wound, but any weapon with pointed end or relatively sharp edge can be used as, for example, knife, scissors, sword, ice pick, screwdriver, shears, broken bottle, broken china. Here the pictorial diagram of knife, scissors, sword, screwdriver, shears, broken bottle, broken china. Now the next point is type of stab wounds. Shapes are given. First is spindle shaped, second wedge shaped, third round shaped, fourth fishtail shaped, fifth rectangular slit. First one is spindle shaped wound, caused by blade with both edges sharp, results in spindle shaped wound. Stab wound resulting from blade with both edges sharp, resulting in an oval or spindle shaped wound. Wedge shaped wound, teardrop or wedge shaped wound caused if one edge of blade is sharp and other is blunt. Here, as you can see in the image, the upper edge of the knife is sharp edge and lower edge is blunt edge. Stab wound caused if one edge of blade is sharp and other end is blunt, resulting in the teardrop or wedge shaped wound. Third shape is round shaped wound, resulting from a round object. Stab wound resulting from a round weapon such as cylindrical shaft. Fishtail-shaped wound resulting from a weapon with one edge sharp and other edge square off. Stab wound resulting from a weapon with one edge sharp and other edge square off, forming a fishtail-shaped wound. The last one is rectangular or slit-shaped wound. It caused due to a rectangular object. Stab wound caused by a rectangular or flat-tipped weapon resulting in irregular or irregular slit. Depth and thrust of stab wound. Depth of penetration. When a knife is used for stabbing and withdrawn along the same tract, it forms a wound track inside the body. The depth of stab wound helps estimate the length of blade used. Depth of penetration and wound tract, as you can see in the image. Wound tract measurement. Measurement of internal wound tract indicates the dimension of weapon. Depth of stab is an important parameter in forensic examinations. Movement and rocking of weapon. Movement of weapon in wound. If the knife is withdrawn along the same track, the wound remains consistent with blade dimension. Measurement of wound track helps to identify the weapon used. Key forensic importance help in determine the blade length, assistant in reconstructing the mechanism of injury, provides evidence about force and direction of thrust. Consistent wound as mentioned or a pictorial diagram. First diagram consistent wound and second is rocked wound. Direction of stab injury. Direction of stab injury or the direction of wound depends upon the position of weapon and movement of victim at the time of assault. The track of wound indicates the direction, whether it is upward, downward, inward, or backward. By careful examination of entry and exit wounds, the direction of force can be determined. This helps in reconstructing the manner and the circumstances of injury. Patterns of stab injuries. Patterns of stab injuries. If weapon is used for stabbing enters the skin obliquely, the edge of wound that first cuts the skin becomes beveled, while the other edge overhangs the wound. If the weapon is withdrawn along the same track, the wound margins remain clean and regular. If the weapon is twisted or rotated inside the wound becomes larger and irregular. The movement of victim or assailant during the stabbing may produce multiple cuts at the margin of the wound. Patterns of stab injuries: straight, twisted. Straight, withdrawn along the same tract, clean and regular. Twisted, Rocked inside wound, larger and irregular, movement of victim during stabbing may produce multiple cuts at the margin of the wound. Dimension of stab wound, length and breadth. Length of stab wound is usually corresponded with that of blade. Breadth in measurement of wound may be shallower than actual breadth of blade due to elasticity of skin, gapping of wound and contractions, postmortem shortening or underlying muscles. Dimension of stab wound. Depth of stab wound is often more than length and breadth. Stab wound appears short and wide because the long axis of wound is at muscle fiber or elastic tissue of skin. Greater depth, short and wide, elastic tissue of skin, muscle fiber, short and wide, breadth, and elastic tissue of skin, elastic tissue. Medical legal importance, type of weapon used can be known, dimensions of weapon can be known, movement of knife in the wound can be known, depth of thrust can be known, direction of thrust can be known, amount of force used can be known, age of wound can be known, manner of infliction that is suicidal, homicidal, accidental can be known. Thank you.